There's a tragic story hidden in COVID-era cancer statistics that has nothing to do with vaccines, but the timing has created perfect conditions for misunderstanding. Let me explain what actually happened during the pandemic and why we're seeing cancer diagnosis patterns that some people are incorrectly attributing to vaccination. When COVID hit, healthcare systems essentially hit pause on routine care. Screening mammograms were canceled. Colonoscopy appointments were postponed indefinitely. Dermatology clinics closed for non-urgent visits. People who noticed worrying symptoms avoided going to the doctor because they were afraid of catching COVID in healthcare settings. Medical resources, staff, and equipment were redirected toward pandemic response. This created an enormous backlog of undetected cancers. Here's what we know happened. Cancers don't stop growing just because healthcare is disrupted. Throughout 2020 and into 2021, tumors were developing and progressing in people's bodies without being detected. Breast cancers that would have been caught at stage 1 during routine 2020 mammograms continued growing undetected. Colon cancers that would have been found during 2020 colonoscopies remained hidden. Melanomas that would have been identified during skin checks were missed. When healthcare services finally resumed and people returned for their delayed screenings, there was a predictable surge in cancer diagnoses. But here's the critical point. These weren't new cancers that suddenly appeared in 2022 and 2023. These were existing cancers, often at more advanced stages than they would have been if detected on schedule, finally being diagnosed after long delays. Now overlay the vaccine timeline on this. Mass vaccination campaigns ramped up in 2021 and continued through 2022. Exactly coinciding with the resumption of normal healthcare utilization and the resulting backlog of cancer diagnoses. The temporal correlation was pure coincidence, two independent phenomena happening at the same time. Epidemiologists have documented this delayed detection effect clearly. Cancer screening rates dropped dramatically during lockdowns. The stage at diagnosis shifted toward more advanced disease. The patterns are exactly what you'd predict from interrupted screening, not from any new causative factor. What makes this particularly tragic is that some people whose cancers would have been highly treatable if caught early in 2020 or 2021 instead faced advanced stage diagnoses in 2022 or 2023 after the delay. Early-stage breast cancer has excellent survival rates. Stage 4 breast cancer is far more challenging to treat. Those delays likely cost lives, real preventable deaths resulting from healthcare disruption during the pandemic. When people misattribute these delayed diagnoses to vaccines, it does multiple forms of harm. It creates unnecessary vaccine fear based on false causation. It diverts attention from the actual problem, which was healthcare disruption and the importance of maintaining screening continuity even during public health emergencies. And it dishonors the people who suffered worse outcomes because of delayed diagnosis by turning their stories into misinformation fodder. This is why understanding healthcare system dynamics is so important when interpreting disease trends. You cannot just look at when diagnoses occurred in isolation. You need to understand what was happening with screening capacity, healthcare access, and patient behavior during that entire period. The delayed diagnosis problem is a perfect example of how complex factors can create patterns that look suspicious if you don't understand the full context, but make perfect sense once you do. The lesson for future public health emergencies is clear. We must find ways to maintain cancer screening and routine healthcare even during crises. The cost of disruption shows up months and years later in advanced diagnoses and worse outcomes.